Now here we discuss about the attachments of radius. First we discuss about the upper end. So this is the head. The superior surface of this head is covered with the articular cartilage because this area articulates with the capitulum of the humerus and forms the elbow joint. Then at the radial tuberosity, here we have insertion of biceps brachii muscle. So it is marked with blue color. Then the lateral aspect of this upper end, it is again marked with blue color. This is denoting the insertion of supinator muscle. So here we have the insertion of supinator muscle. Then here this is the anterior oblique line. At the anterior oblique line, we have origin of flexor digitorum superficialis muscle. So this muscle, the flexor digitorum superficialis muscle, it is a muscle of your front of forearm. Then at the lateral surface, here we have the insertion of pronator teres muscle. So this is the middle 1/3 of the lateral surface of this bone, which is marking the insertion of pronator teres muscle. Then this is the anterior surface. Whole of the upper 2/3 part of the anterior surface, it is giving origin to flexor pollicis longus. So this is the flexor pollicis longus. This muscle is for the thumb. Then the lower 1/3 part of the anterior surface, here we have insertion of pronator quadratus muscle. So this is the pronator quadratus muscle insertion. Then at the styloid process, here we have the insertion of the brachioradialis muscle. So this is the marking of insertion of brachioradialis muscle. Then at the posterior surface, we have insertion of two muscles, that is this upper part, it is marking the origin of abductor pollicis longus. So this is the origin of abductor pollicis longus. Below that we have, this is the origin of extensor pollicis brevis. So this is the insertion of extensor pollicis brevis. Then at the lower end we have this dorsotubercle and different grooves over here. These grooves are because of the passage of extensor tendons. So we discuss them one by one. The first groove is this, that is lying between the anterior border, this is the anterior border, and this is the styloid process. So between these two we have this first groove. This first groove is providing passage for abductor pollicis longus and extensor pollicis brevis. So this is important. This first groove is providing passage for abductor pollicis longus and extensor pollicis brevis. Then we have the second groove, that is between the styloid process and the dorsotubercle. So this is the second groove of this bone. This second groove is providing passage for extensor carpi radialis longus and extensor carpi radialis brevis tendons. So these two tendons, they are passing through this second groove. Then we have the third groove, which is lying just medial to the dorsal tubercle. So this is the dorsal tubercle and this is the third groove, which is lying just medial to the dorsal tubercle. And this is because for the passage of extensor pollicis longus tendon. So here we have the passage for extensor pollicis longus. Then the fourth groove. The fourth groove is lying medial to this groove. This is the fourth groove. This is for the passage of extensor digitorum, extensor indicis, and the posterior interosseous nerve and the anterior interosseous arteries. So these structures passes through this fourth groove. Then the attachment of wrist joint also lies at the anterior border of this lower end of the bone. This is marking the attachment of capsule of the wrist joint. Then this is the interosseous border So here we have the attachment of interosseous membrane, which is lying between the radius and the ulnar bone. So here we discuss about the attachments of the radius. This completes our topic. Thank you.